So why we talk about Homeopatia Viva? Because our patients are living and we are treating the vital force. So it's always a great pleasure for me come here to present cases of our patients, of our everyday life, of our consultations. I am working as a medical doctor in Germany, using quasi only homeopathy since 30 years, 30 años. Of course, we have patients. We have a lot of patients and a lot of experience. So the first case I choose for you is a long-term case because it's also something special. If you have a patient for one cure, okay. For 5 years, okay. For 10 years. But if you have a patient for 20 years, 25 years, and to accompany all these years with homeopathy, that's also a special skill. And I want to show you how there are also certain systems of thinking to be successful in that treatment. So one of my favorite patients, she's normally very funny. And the case history, in that time she was 43 years old. She's a patient of mine since more than 20 years. And she has a very special disease. She has kind of epileptic attacks if she is under stress. If something is too much for her, she will fall down, will have attack, and cannot move. And after such an attack, she is very weak for 1 day, more or less, cannot concentrate. She also has fatigue, and the cause of everything is very interesting. She was born with a strabismus of the eyes. You understand strabismus? The eyes are not looking in the same direction. That means, that means that the brain has to work much more than with a normal person. I did not think before about that problem, but she's telling me, listen, if I have too much information, my brain is getting overloaded and she will have an attack. She's a very, very friendly patient, very emotional. And the attack goes on with weakness and with a failure of concentration. So normally it was working like this for many, many years. It was working like this. A phone call. Dr. Gessner, I need your help. What happened? Another attack. It was luckily it was more or less every half a year, more or less, not so often. So normally I gave causticum. And with causticum, we have that weakness of the muscles, we have that nervous system impact with causticum, and she's very, very she has a lot of empathy for other people. So causticum is a very good remedy. And normally, she takes C30. After 2-3 hours, she's much better. She can get up, she can walk like this. Okay. Years and years and years between she had different acute diseases. We were treating these diseases, but it was going well. One day, okay, I talked about this. One day, she was phoning me, again an attack. I gave causticum, did not work. She said, now I'm weak since, go back. 5 days ago, she again had an attack and she took causticum C30. Concentration was better, but she's still so weak, so weak, so weak. So I was thinking, what shall I do? And one of the main remedies for muscular weakness are Kalium phosphoticum. So, and if we know our patients quite well, we have all that system in our head. I said, Beatrix, last year she got Kalium carbonicum because she had backache. Then she got Kalium carbonicum because of a sinusitis. And causticum also contains calcium, sulfur. So I said to myself, okay, Kalium phosphoricum should be a good choice. It's not a very different remedy, it's a similar remedy. So with Kalium phosphoricum, C30, she was much better in a short time. Time goes over, 25 years, it's a long time, so she went into menopause. With severe attacks of hypertension, she had to go to the hospital. It was not very easy. And later she developed flushes of heat, weakness again, and perspiration also. So I was thinking, now we have a hot patient. And Kalium carbonicum is very well known for menopause. I don't know whether you know this. It's very well known for the treatment of menopause complaints. But she is a hot patient at the moment. What did I do? I did switch from Kalium carbonicum to Kalium sulfuricum. Okay? Not so difficult. See? And this was working very well. And later, the menopause was not so difficult anymore. She was under stress and she developed pain of the stomach and joint pains. So I said to myself, no, I'm not going to Bryonia now or to another remedy. I stay in the Kalium group, and I was giving Kalium carbonicum again. Is that clear? Menopause, more hot, was Kalium sulfuricum. Now she's getting Kalium carbonicum. And now she's retired, and she wanted to relax. But she has one mother, one father, and a mother-in-law to help. So it's even more emotional stress than working at her business before. So the mother has cancer, the father is very obstinate, and the other mother-in-law has a lot of dementia. So we can imagine she has a lot of stress, and she's crying, and she's feeling not so well. So here I decided to give Ignacia. And that was 2 weeks ago. Last week she was phoning me. She said it was such a wonderful effect. After some hours, she found herself singing. After some hours of Ignacia, and before she was crying. That's also the bit the way of Ignacia can be, huh? Bipolar. See. And she can handle the problems with the nurses much better, with much more confidence. And so here it was very beautiful to see this patient during the years reacting well on causticum and Kalium, which are inside of causticum also. It's one group, and we switched with a muscular weakness to Kalium phosphoricum. We switched with the menopause and hot flushes to Kalium sulfuricum, and we switched with the stomach pain and joint pain to Kalium carbonicum. But now, so depressed and everything so difficult with the family, she needs Ignacia. Okay? Now I would like to switch and present a case of psoriasis. Can I switch here, please? Sorry. I have to go out and present psoriasis. Not totally go out, just to see.
Where is this?
It's in the same.
In the same page?
Yeah. Stop. It's the same, in the same presentation.
Ah, in the same presentation?
Yeah.
É na mesma apresentação, é isso? No, not here?
No, we should go down, symposium, to look for the symposium, outra vez. Yeah, was another folder inside, no problem. Okay, Symposium 2. Okay, open here, please. I'm a bit German, sorry. Open here, please. Psoriasis, okay? Here, okay. Okay. Más pequeño? No. I like to speak about skin diseases because I have a lot of skin diseases in my consultation, and also because you can see the effects of the amelioration on the pictures. Yes. Okay. Yes, this one, yes. A bit more small, please. Yeah, better, better. This is very good. A bit more big. Yes, very nice. Okay, very nice. So, if we talk about, sorry about the interruption. If we talk about psoriasis, we have some special dermatological points. We have that kind of nails, uñas, very thick, yellow. We have that kind of scabs in the neck. And here, okay, now I go on. Thank you. Can I go on? Next one.
Where is this slide?
Downstairs are the slides. You have to pull.
Okay.
Yes, you
No,
can go
I
down.
have only
Yes,
PDF.
okay. Very good. That's,
PDF.
yes. Okay. And later you have to help again. Okay, introduction. The psoriasis is a Greek word. It's a non-infectious disease. That's important to understand. You cannot infect the other person. And it's an inflammatory disease of the skin with the rate of the cells are very quick. Normally, the skin cell will go in 28 days. That's interesting. It's the phase of the moon, 28 days. With psoriasis, it will be 4 days. They're having very quick, so can we have scroll down a bit? Okay, no, I switch. You go back. You just go back and I will do the pictures now. We just leave that now. So we see here psoriasis of the body also. No, but now we go back, please. We go back to the presentation. Just leave. Yeah.
Okay. This is presentation.
Yes, two.
This is.
Yes, okay, I'm fine now. Okay. Yes, thank you. So it's a bit technical, difficult, no problem. I wanted to show to you the conventional treatment of psoriasis. We have special diagnostics that say environment, nutrition, all these things. We have special treatment, which is not a lot. We can have light treatment, can have cortisone, and at the end, conventional medicine says there is no cure. There is no cure. And that's not right. That's why I wanted to show you. The conventional medicine says there's no cure for psoriasis, and that's not true. So we have different forms of psoriasis. We have little drops, gutata. We have the folds of the body affected, and we also have the head and the nails. Okay. Now our first case. Sorry for the mixture a bit. That's a young man, and you see there's that round scabs. And if you would scratch, you would leave a little skin, silver skin, and it would bleed. That's a diagnostic for psoriasis. So we have these points. Case history. A teacher, 34 years old, skin eruption since 1.5 years. In former times, dry skin around the eyes, nothing more. His father also has kind of psoriasis, and his mother has problems with the thyroid, which is an autoimmune disease. So with both parents, we have an inclination to develop autoimmune diseases, and psoriasis is an autoimmune disease. Why? Because it's not only affecting the skin. If it's suppressed with cortisone therapy or even stronger therapies, it can go inside, affecting the joints, mainly the joints, and also the thyroid, and also the intestines. So it's not so easy to treat psoriasis. So he's coming now, and he has that kind of eruption not only some months, more than 1 year. That's not so nice. And he does not want to take cortisone. So there's a certain stress at school. He's working in Switzerland, and in Switzerland the people are different than in Germany. The Germans are known to be a bit strict, perhaps, but I can tell you, if you go to Switzerland, forget about the strict Germans. It's not like this. So he went to school, has some colleagues, he's not feeling well, and he says, I'm feeling reserved, like behind a curtain. And he has a relationship to his girlfriend is 10 years younger and is living in another country. So they don't meet every day. They have to, he has to travel to meet her, and normally he likes to travel. Okay. His bladder, he has to urinate more often. So you feel something is not very well on the physical plane. And the sleep normally was good. Last 2 years, he's waking up at night. And his heart has a certain kind of pressure. So, my dear colleagues, the remedy is easy. You all know the remedies. Do you have any ideas? We have a person who is a responsible teacher. He's more reserved, sleeping worse, less well. He has a bladder problem and a pressure on his heart. Do we have any ideas of the remedy? Okay. It was, here we see again the elbow. It's not so easy and itching. So it was natrium muriaticum. I decided to give natrium muriaticum. Everybody of you would know the remedy and could treat if you have the right idea. Yes? So I was giving a single dose, waiting. And now something interesting will happen. I will explain something about the high potencies for you. 1 week later, the skin is getting worse. But he's feeling better inside. That means that could be a certain aggravation in the right direction because he's feeling better. Look, the skin is worse. Even cracks now. So 5 days later, the itching is getting a bit less. So we believe, okay, it could be the right direction. But look, all the satellites, it's still bigger than in the beginning. Don't be afraid, because he's feeling better. Don't be afraid. So 12 days later, 24 days after taking the remedy, now the skin is getting better. So we see it's getting more soft in the middle. Here it's getting more soft. 6 weeks later, improving a lot now. Now it's getting better, okay? Very mild. And 4 weeks later, it's nearly gone. Of course, the skin now is more white than the environment, and that will take 1 year to have a normal color of the brown skin. But you see, the eruptions are gone with 1 single dose of natrium muriaticum. Here. He's very happy. So, that could be the end of the case, but it is not the end of the case. As I told you, long-term patients. So, what's happening? Conclusion. With the C30, we have to wait 1 month, 4 weeks in chronic cases. And with the 200, we have really to wait 6 weeks. So normally, if I am treating skin conditions like eczema, I don't use high potencies. I use LM potencies, which I can control much better. But with psoriasis, which is a long-lasting, slowly developing disease, it's better to have high potencies. You understand? Okay, 12 weeks later, 3 months later, he was happy. Now, everything was much better in the holidays. He went to Spain, he went to Greece, and at school he's feeling more relaxed. His psychological problem is gone. No heart problems, no bladder problems, he's sleeping well. He really likes to travel, and he feels much better at the sea. So, but now it's coming back slightly after 3 months. So, what shall we give? Shall we repeat natrium? He's feeling emotionally better, he's sleeping better, does not have bladder brains. So, he likes to travel, better at the sea, better outside in summertime. I gave tuberculinum. Why? It's very important. We always have certain connections of remedies. The last case, I was showing the connections between the kaliums and causticum. Here, I can show the connections between the constitutional remedy, and if there is starting to be a blockage, we need the nosode. In his case, he likes to travel a lot. We needed tuberculinum, LM potens. He gave that for 10 days. It was getting better and getting worse again. He stopped and he was fine. So 6 weeks later, despite of the winter time and the cold weather, the skin is much better. Okay, in this case we needed the nosode, and I can tell you this is now about 7 years ago. He never developed again psoriasis. If he is under stress, he has a little bit of scabs on the scalp. If we talk about scabs on the scalp, next case. We skip this. That's a woman. She comes in winter time and she has very big white crusts. 45-year-old woman, since 20 years psoriasis of the scalp. And this is not a joke. It's not easy and not nice. If you have that during the winter, she's losing hair a lot. So, and nobody could help. All these dermatological lotions and shampoos were not working. So, she also has pains in her left hip, and she's a vegetarian, so the food is good. and she did not have any more different symptoms. Only this scalp and these crusts. So we have a local disease and we need a local remedy. Which is a remedy which is very attracted to the scalp. Mezereum. Mezereum. She got 200 and everything went well. And also the hip pains went better. So we have a constitutional treatment here. Next winter, she came back, again, starting white scabs. So no fear, what do? Same situation. We give Mezereum again. Yes? Now we have a more difficult case, a little boy. After vaccination, he developed an eczema. A bit a special eczema. Normally you have it in the bands here, in the bands here, but on the arm in that form, looking a bit peculiar. A very friendly child, likes a lot of attention. So I said, okay, I will start with phosphorus. Very nice, friendly child. Phosphorus 30, phosphorus 200. Ups and downs, there was no real amelioration. So I said to myself, okay, it started after a vaccination. I will give 2 years now, hoping in 2 years. So a little bit better, worse again. So I said, okay, now I will give the nosode, tuberculinum in this case, because tuberculinum is connected with phosphorus. So a bit better, worse again. I gave sulfur to clear up the situation. I mean, that seems a bit a story in 5 minutes, but many, many weeks now, months. The mother is in despair, crying. Nothing is helping. So I said to myself, here seems to be a blockage. And we are now 7 months after beginning of the treatment. The mother has patience. So I go to the repertory. I look up skin eruptions after vaccination. We have Tuya, we have Silicea, we know these remedies well. We have Sarsaparilla and Mezereum. And if we look itching at night, there's Mezereum, diarrhea. He had also Mezereum. Here we see the repertorization. Oh, I said to myself, that could be Mezereum. Why? Because also these strange spots, they looked a bit like psoriasis and not so much like allergic eczema. So 1 dose of Mezereum citrenta. After 3 weeks, he's much better, less itching, no diarrhea. And after 5 weeks, he's very good. 8 weeks after a single dose of Mezereum 30. But that's not the end of the history, because we are still going on with our patients. So he's much better. He's a funny boy, looking like this. Now he needs his next vaccination. What shall we do? Tranquilo, tranquilo, no problema. He got the vaccination. After 1 week, everything is fine. After 2 weeks, everything is fine. After 3 weeks, it's starting again. No fear. We repeat Mezereum citrenta. After some weeks later, everything is good and never came back. This little boy, it's now 25 years ago. He's a big man now, has a girlfriend, is healthy and never had skin eruptions again. That is what we call cure. And that's what Hahnemann said in his first paragraph. The main issue of the medical doctor is to take away the disease, what we call cure. Yes? Sweet. You see, everything is gone. So, to finish, a very, very short but very nice patient of mine. I know her since more than 20 years. Here we have an autoimmune disease, which is called Hashimoto. You have heard about Hashimoto disease of the thyroid. Okay. So the problem is with Hashimoto. In the first step, they get hyperthyroidism. They have palpitation, perspiration, loss of weight, and fatigue. And in the second step, they got the destruction of the thyroid. And this is dangerous because this will destroy the thyroid, and you have to take hormones for the rest of your life. And normal medicine, allopathic medicine, says there is no cure. So she came to me and she said to me, Dr. Gessner, you have to do this. I knew her some years already. We had a good contact. Okay. So she came because she felt very weak, a lot of palpitations, loss of weight, and the concentration was terrible. 55 years old. That's not a symptom of menopause. No, it's a symptom of thyroid. So I said, check the thyroid. Very high antibodies, and the general doctor said that she should take thiamidol. She did that without any effect. So she feels very weak, perspiration, flushes of heat. I know this patient. She reacted very well on Calcarea carbonica for many years. But now, this is not the Calcarea carbonica situation. Flushes of heat, perspiration, weakness, that leads me from Calcarea carbonica to Kalium carbonicum, because Kalium carbonicum has a weakness and also the flushes of heat. So, a single dose. 10 days later, she's feeling better and has more energy. This is good. Less perspiration and the heart is more calm, less palpitation. So we are on a good way. 3 weeks later, since a few days, she has more palpitation. Now, one very important thing. Normally, after a dose of C200 in a chronic disease, we have to wait 6 weeks. But here, we have acute condition. So she was feeling better. After 3 weeks, she was getting worse. So I did repeat, of course, I did repeat C200. And I was waiting to repeat later 1M or 10M. So follow-up 6 weeks later, step by step, she has more energy, gaining weight, less perspiration. 2 months later, the autoimmune bodies are down now. The disease is cured. And this was 15 years ago. I talked to her last week. She's living in another part of Germany because she had an infection. She never had any problems with the thyroid again. That was my presentation. Thank you for your attention. And I wish courage for you to treat your patients in acute conditions and also long-term for many, many years.
Dr. Beatrix, thank you very much for your presentation. Muito obrigado à doutora Beatrix pela sua apresentação. A doutora Beatrix tem realmente esta característica de apresentar casos clínicos muito personalizados, ou seja, ela segue os doentes durante meses, durante anos, e pode-nos trazer realmente um quadro do paciente ao longo dos vários anos e da utilização dos medicamentos homeopáticos. Esta é a abordagem que se designa habitualmente por uma homeopatia clássica, ou também chamada às vezes homeopatia unicista, que procura utilizar um medicamento de cada vez, habitualmente numa duração muito alta, como vocês viram, 30 CH, 200 CH, e aguardar os resultados. Portanto, destina-se de facto a este tipo de abordagem a pacientes e a situações clínicas delicadas, situações clínicas que não tiveram resposta com uma abordagem de medicina convencional, e é nestes casos muito específicos que os doentes recorrem justamente à homeopatia. E eu quero agradecer, de facto, a forma muito detalhada como a doutora Beatrix apresentou, e ao mesmo tempo de uma forma muito sintética e resumida, porque o que pretendemos com esta forma de apresentação é justamente mostrar as potencialidades de uso clínico e como ele deve ser diferenciado de acordo com cada paciente, e realmente a forma como a doutora Beatrix nos apresentou dos casos tão variados, desde esta última situação autoimune, chamada tiroidite de Hashimoto, os casos de psoríase, as respostas, as reações à vacinação. Enfim, todos estes casos que foram apresentados são muito particulares a cada paciente e exigem uma abordagem personalizada, que requer atenção e que requer, muitas vezes também, a doutora Beatrix mostrou isso, o recurso àquilo que nós chamamos o repertório. O repertório homeopático, há vários repertórios, mas são, digamos assim, índices que, em função do quadro clínico que o doente apresenta, há as várias hipóteses de medicamentos. E a forma como os escolhemos é de acordo com as características que o doente apresenta mais em particular. E isso, por vezes, torna-se necessário. O médico homeopata não tem a capacidade de saber todos os medicamentos homeopáticos em detalhe e tem necessidade de recorrer a esse tipo de abordagem. Portanto, eu quero também salientar esse aspecto, o cuidado que houve e os resultados que foram obtidos. Doutora Beatrix, muito obrigado.
Muito obrigada.